very first topic of anatomy. So in this video we will be talking about clavicle. So total of all there, I am using BD Chaurasia so that it's easy for you to tag along with the book, and in the end you feel very satisfied that you have covered something. So there are total 206 bones in man. The upper limb contains 64 bones, and out of which 32 bones are on one side and another 32 bones are on other side. Okay, so first of all we will talk about the clavicle. Clavicle is it's a long bone. This is a very good point, and it comes as a MCQ, that is it a long bone? So it is a long bone. It supports the shoulder so that the arm can swing clearly away from the trunk. The clavicle transmits the weight of the limb to the sternum. The bone has a cylindrical part called the shaft, which is this whole part, and then there is some lateral part and the medial part. So the lateral end is flat and the medial end is large and quadrilateral. Quadrilateral means it will look something like this. Okay, why it is something like this? Because it will attach with the sternum. Okay, then the shaft is slightly curved so that it is convex forward in its medial 2/3 and concave forward in its lateral 1/3. And how is it so? Convex forward like this, okay, and concave forward like this. So this shaft will be slightly curved. Then the inferior surface is grooved. It has a groove in middle 1/3. So peculiarity of the clavicle, it's only long bone that lies horizontally. We will see it will be lying like this with the humerus here, and then there is a sternum. Take a sternum like this. Okay, then it's a subcutaneous throughout. You can feel the clavicle. If you touch the clavicle you can feel it, so it's subcutaneous. It is the first bone to start ossifying. So it's a very good MCQs, that which bone start ossifying first, and this is the clavicle. It is the only long bone which ossifies in membrane. This is again only long bone, so again this is an MCQ. It is the only long bone which has two primary centers of ossification. Another, this is also MCQ. There is no medullary cavity in this. It is occasionally pierced by the middle supraclavicular nerve. It receives weight of upper limb while lateral. This is not that much important. Then shaft. Shaft is divisible into the lateral 1/3 and the middle 2/3, as we talked about, like this. So it is middle 2/3 and this one is lateral 1/3. The lateral 1/3 of the shaft is flattened from above downward. It will be pinched off like this, something pinching. It has two borders, interior and posterior. The interior border is concave forward, as we have talked that middle 1/3 is concave forward. The posterior border is convex backward. So interior border and posterior border, it's like this. So it's concave forward, interior border, and posterior one is convex backward. This part of the bone has two surfaces, superior and inferior. So if it's a thing like this, we are talking about the lateral 1/3 part. So this is its superior surface, it's the interior border. This is a posterior border, and below the superior surface is the inferior surface. So the superior surface is subcutaneous. Okay, we can feel it if you touch the lateral part of the that is attached with the humerus. You can feel it. And the inferior surface present an elevation called the conoid. It's a very important MCQ. The conoid tubercle is where? Inferior surface. And a ridge called the trapezoid ridge. Okay, let me show you here. Here you can see this is talking about lateral 1/3 part. This one is interior, posterior part, and in the inferior surface you can see this is a conoid tubercle, and this ridge is trapezoid ridge. So these two things are very important. Okay, the medial 2/3. Now we are talking about the medial 2/3. Is rounded and is said to have four surfaces. How we are going to say it's four surfaces? Because we have talked it's quadrilateral here. So it's the interior surface is convex forward. Again, it's like this. The posterior surface is smooth. The superior surface is rough in its medial part. So if you touch the bone in the superior surface, it will be rough in the medial part. The inferior surface has a rough oval impression at the medial end. The lateral half of the surface has a longitudinal subclavian groove, as we had talked about here. The inferior surface has a groove. So the groove is called subclavian groove. The nutrient foramen lies at the lateral end of the groove. And where is the nutrient foramen? Lies at the subclavian groove, lateral end. Look at this. So this one, it's the sternal end. That's the acromial end where the acromion process, clavicle gets attached with the acromion process. Interior, posterior, this is the superior, and then inferior. So this is the impression for costoclavicular ligament. The costoclavicular ligament will attach here. Why it's called costoclavicular ligament? Because costo is rib. So below this there is a first rib. It's going to attach something like this. So it's costoclavicular. Then here it's a subclavian groove that we have talked about, and the nutrient foramen would be at the lateral end of the subclavian groove. Okay, the median or sternal end is quadrangular and articulate with the clavicular notch of the manubrium sternite to form the sternoclavicular joint. Now you'll be like, okay, what is it? What we're talking about? Okay, I think there's no image here, so let me draw that for you. Okay, median sternum is quadrangular and articulates with the clavicular notch of the manubrium sternite to form the sternoclavicular joint. Okay, sternum is something like this. This is manubrium of sternum, and this part here is clavicular notch. And with this thing, medial end, it get attached. This part, the sternal end, gets attached with the manubrium. So with the clavicular notch of the manubrium, and what does it form? It's sternoclavicular joint. Sternoclavicular joint means sternum and clavicular are getting joined here. So sternoclavicular joint. The articular surface extends to the inferior aspect for articulation with the first costal cartilage. Okay, its attachment are important. It gets asked in viva a lot, so you need to get these straight. Okay, at the lateral end, the margin of the articular surface for its acromioclavicular joint gives attachment to the joint capsule. Okay, we have talked that this part, the lateral third, get attached with the acromion process here. Okay, so the acromion process, if it gets attached, this part will be called as acromion clavicular joint, right? So acromion clavicular joint gives attachment to the joint capsule, and this one will have capsule on it to cover itself. So this, the lateral end is giving this attachment. At the medial end, the margin of the articular surface for the sternum gives attachment to the fibrous capsule of the sternoclavicular joint all around. Like we have talked, this is going to attach with the sternum. So this will have a capsule of sternoclavicular joint on its whole surface. Fibrous capsule of the sternoclavicular joint all around. Articular disc posterior superiorly. Interclavicular ligament superiorly. Okay, what is this interclavicular ligament? We haven't talked about this. Okay, interclavicular ligament is like this. This is one clavicle. This is another clavicle. This is manubrium. It's getting attached something like this. Apologies for this. Okay, this is a sternoclavicular joint, and then here, this part, this is interclavicular ligament superiorly, both sides. Then lateral 1/3 of the shaft. The anterior border gives origin to the deltoid. So where is the deltoid? Deltoid is a very important muscle. You have to remember it. The lateral end, this is the lateral end, and this one, this is the interior border. We have talked, this is the anterior border, this is the posterior border, and the interior border is giving attachment to the deltoid. Then the posterior border provide insertion to the trapezius. Okay, in this book the red is origin and blue is insertion. So trapezius is getting attached, insert here. Trapezius is a triangular shape muscle like this on back. It's very like T shape, you can see. So it's getting its insertion here, it's originate from here. Okay, then deltoid at the interior and posterior has trapezius. The conide, tubercle and trapezoid ridge give attachment to the conide and trapezoid parts of the coracoclavicular ligament. Okay, it's very easy to remember that this is a acromion process here, and then here is a coracoid process like this. Okay, so coracoid process will have an attachment with a clavicle, coracoclavicular joint. You can note this is not actually a joint, you can say it's attached with a ligament. So the how we are saying that coracoclavicular ligament, because coracoid process is below and clavicle is here, so coracoclavicular ligament. So it's very easy, you have to remember the conide and trapezoid ridge are attachment to the conide and trapezoid part of the coracoclavicular ligament, which is coracoid is below here. Okay, we are done with the lateral 1/3 of the shaft, then medial 2/3 of the shaft. Most of the anterior surface gives origin to the pectoralis major. So medial 2/3, very big part, you know already, you can see that it's a medial 2/3. So the interior surface also giving a big part to the very big muscles, which is pectoralis major. Here you can see its origin of pectoralis major at the interior part and also at the posterior part as well, like this one. Half of the rough superior surface gives origin to the clavicular head of the sternocleidomastoid. Sternocleidomastoid is a very important muscle. Let me show you something like this. In the neck it goes like this from clavicle, then this it starts from the sternum. Let me show a person neck. This is its ear, this is the styloid process, you can say like this, go like this. Okay, so the clavicular head of the sternocleidomastoid will give half of the rough superior surface. We have read it about this, that medial 2/3 of the shaft, superior half of superior surface is a very rough attachment, so that rough attachment is for the sternocleidomastoid. Okay, then the oval impression on the inferior surface, we have talked about this, there is some oval impression that is for the costoclavicular ligament, as we have talked before. Here there is the rib here, this is at attachment to the costoclavicular ligament. Okay, so middle shaft is almost done. The subclavian groove gives insertion to the subclavius muscle. Okay, there is a groove here, very important. The nutrient foramen is at the lateral end of the groove. So subclavian, the name is showing that it's getting giving attachment to the subclavius muscle, insertion of subclavius muscle. Even if you don't remember the region and insertion, just remember the muscle names, it will be very useful. Okay, the margins of the groove give attachment to clavipectoral fascia. Okay, clavipectoral fascia, what's name suggesting? Clavicle, pectoral muscle, pectoralis major. So if the subclavius muscle is here, the margins of the groove, this one is giving clavipectoral fascia. Okay, so two things. The posterior surface close to the medial end gives origin to the sternohyoid muscle. This part, this one, this is the posterior surface, this was the interior surface. The posterior surface near to the middle part, sorry, not this one, this one, sternohyoid. Why it's named sternohyoid? Hyoid is the bone in neck, it's a person here it's neck, this is the hyoid, and here it is a sternum, manubriae of sternum, it's a sternum, and the muscles is going like this. you can say, and here it is clavicle. So the clavicle is giving attachment to the sternohyoid muscle. The subclavian vessels and cords of brachial plexus pass towards the axilla, lying between the inferior surface of the clavicle and upper surface of the first rib. Okay, what is it? Look, subclavian vessels and cords of brachial plexus. Subclavian vessels, you can say, the blood vessels that are passing through this region, and then the brachial plexus is the nerves that are going through neck to the, you can say, upper limb. So they are neck vertebra, then there's a shoulder, humerus, upper arm, forearm. Apologies for my very bad drawing, I'm not this much bad. Okay, so let me show this in yellow. Brachial plexus and the subclavian vessels pass towards axilla, lying between. Okay, what's axilla? Axilla is this part above. If you move your arm like this, let me show you if there are some images here. Okay, I will prepare some images for the axilla, but you can say the way axilla is your armpit part. Okay, so nerves are going towards your armpit through inferior surface of the clavicle. Here it's a clavicle, inferior surface of the clavicle, and the upper surface of the rib, as we have talked about. Above is the clavicle and below is the rib. So all the nerves and vessels, these are the vessels, these both, and then there are nerves are passing through clavicle and rib. So here is it. Okay, ossification. What's ossification on? Clavicle is the first bone in the body to ossify, except for its medial end. It ossifies in membrane. So it's the first bone, but it's a medial and ossifies in the brain. It ossifies from two primary centers. As we talked, it's the one which has two primary centers and one secondary center. The two primary centers are here, then secondary center is here. The two primary center appears in the shaft between the 5th and 6th weeks of intrauterine life, infused about the 45th day. The secondary center for the medial end appears during 15 to 17 years, infused with the shaft during 21 to 22 years. If you're 21 to 22 years, your secondary center has ossified. Occasionally, there may be secondary center for the acromial end. Clinical anatomy. We are going to talk about this. The clavicle is commonly fractured by falling on the outstretched hand. Indirect violence. If your hand is outstretched and you fall over it, the most common site of fracture is the junction between the two curvatures of the bone. Okay, we have talked. The bone has curvy S shape, kinda. So what's the joint here? This one. This can get damaged. The lateral fragment is displaced downward by the weight of the limb. It will be displaced downward. Why? Because humerus is getting here, then upper limb, arm and hands. So it will be going downward with all the load on it. Trapezius, by the weight of the limb, as trapezius muscle alone is unable to support the weight of the upper limb. The clavicle may be congenitally absent or imperfectly developed as a disease called cleidocranial dystosis. It's a disease where clavicle will be absent and you can squeeze yourself like this, like a cat. In this condition, the shoulders droop and can be approximately anteriorly in front of the chest, like this. Okay, look at this one. This is the fracture of the clavicle. It's a green stick fracture called green stick fracture. The sternocleidomastoid, we have talked about the sternocleidomastoid. The clavicular part is here, superior side, then pectoralis major, and here it is the trapezius on this side of the bone. Yes, here we have talked with trapezius is here, and you can see it's going to be downward. It's drooping downward. Okay, what is it? What's this is telling? You can see there, this is the sternum, these are all the ribs here, but we cannot see something horizontal here, so that means there are no clavicles. So that's called cleidocranial dystosis. That's it, we are done with the clavicle.